Visible, sir.
Okay.
Sir, this is the last slide, huh?
Yes, sir. I think we are live also, sir.
Sir, I'm just checking on
Yes,
YouTube. Yes, sir. We are live.
Okay, sir. Shall we begin, sir?
Yeah, good to go, sir.
1 minute, sir. Good evening, dear residents. It's my honor and pleasure to introduce Dr. Siddharth sir, who is one of the famous faculty for PSM, and he has great academic excellence. He did his PG in AIMS and worked in PGA also. So today, what we are going to discuss is research in respiratory medicine, an integrated approach, and also special focus on how to select thesis and what are the aspects that should be in your mind. So before starting the session, I would like to ask Dr. Siddharth sir to describe why research is very important.
Hi guys, good evening all of you. You know, the question which is over here is why research, but more than that, I'll say what is exactly at stake if you are good at research. The first answer is your paycheck. Now, guys, you would probably think, why am I saying your paycheck is at risk? Because now it is being seen that those of us, whether we are clinicians in any discipline, those of us who are having a good research acumen are able to get a better package from the corporate setups. Because we can use this acumen to get research projects, funding from international organizations. We can become the center for excellence for different kinds of studies. Plus, we get more leverages when we plan for workshops and training sessions. So the first thing is your paycheck is driven by this. And this works out across every discipline as on today, if you ask me. The second, definitely your academic growth. See, guys, please understand. Imagine you are applying for a faculty position at a government medical college, whether it be a central institute, whether it be a state medical college, whether it be a private medical college. If there are two candidates who are absolutely same, null hypothesis, both are same, but there is one candidate who has got good research acumen, which is visible not by words, but in means of good standardized publications. Probably because you are a fresher, you would be having 1 or 2 research projects. And your presentation in conferences and different kinds of academic meets, you get higher marks. These days, NMC has prepared a checklist where as interviewers, we grade you or give you scores for all these things. So you get a good score. So that is the second use of this. Third, your desire to roam the world. Trust me, there cannot be a better thing to say that I'm going to a conference to London or to Japan and you can see the place. And in respiratory medicine, the biggest conference, if you ask me, happens by the union. Yes, which is a conference where we are actually looking into tobacco related lung changes, the tuberculosis. Plus, second, the associations of lung cancer worldwide, especially the European Association, these are all held at beautiful places of the world. So you get a chance to go to this place, explore. They generally give you scholarships because we are from India, which is labeled as a low middle income country. So you get a scholarship to go abroad. So that's another way to look into a positive thing. And last, recognition, guys. See, generally you will see when 15 years back, we used to say, okay, this professor is good because this professor earns this much with a private practice. But now as the government is coming up with Ayushman Bharat and different kind of schemes, Now the recognition is shifting from just monetary earning to monetary plus academic excellence. So if you look into this, probably this slide tells you why this session becomes very important for any of you and why you should try to build an acumen. And trust me, the best example I'll give you is for the training of systematic review meta-analysis. When I was a student, the master trainer was professor and head of PGI Chandigarh for respiratory medicine. Sir was teaching us how to do systematic review and meta-analysis. So you can understand, even at the Apex Institutes, it's the clinicians, especially the respiratory medicine people, who are upfront to actually do this. Over to you, sir.
Yes, as Sir has told that, see, whatever the specialty you are in, it is just your qualification. But your experience these days generally counts on your research. And take any famous respiratory medicine specialist, let it be north, south, east, or west. The reason why he has become famous is not just his qualification. That qualification may make him famous locally, but globally, any person, if he is famous in a specialty, it is predominantly through research. Then, next thing is why we should do research in respiratory medicine. Why there is a lot of scope? Because these days, if you see in the last 10 years, if you ask me out of all the medical specialties, which has grown leaps and bounds, it is respiratory medicine. 10 years back, what we are seeing, 10 years down the lane, right now, what we are doing is completely different. There are a lot of interventions, lot of high-end procedures. And the problem here is you have procedures, you have advances, but there is no sufficient research to prove that they are the best. And you need a critical need for local data. See, all these innovations were there in Germany, were there in US, UK, but how to apply them in a country like India? How to tailor them to the local population is our responsibility. And this research, it encourages evidence-based practice. It will also, as Sir told, a gateway to academic growth and also global collaboration. Now, if you see in Western countries, there are innovations, but they don't have a sufficient population to prove that this innovation work. But India is a completely different scenario. India is the most populous country in the world, and India has the highest burden of tuberculosis and various other respiratory diseases. And if you do proper research, and this research will actually become landmark in that discipline. And forms of research at residency level, your view, sir.
Now, if you look into at the residency level, the most common is your dissertation or thesis. That is mandatory for all of us. Now, this thesis is actually a gateway for publications and also for attending conferences. Now, see, NMC is forcing us that you must have mandatory publication, you must have attended conference. See, that is because NMC wants us to do something which is good. But more than that kind of pressure, I would say you should actually take it as a task with a smile, because probably that is a simple getaway from your routine clinical life. Plus, you can also look into an added research project, which generally happens in some institutes with collaboration with your teachers, or even it might be your own interest. See, the best I'll give you an example is, if you would have seen, like 7-8 years back, the government of India launched cylinders so that it is under the Ujjwala scheme, they would be given it to below poverty line to reduce the use of burning of fuels. And it reduced COPD. Is it actually true? Actually, are you seeing less COPD patients who actually did it? We don't know. The research is still lacking. So probably you can go for such kinds of imaginatory findings and actually look into that. Similarly, pollution related. See, Delhi, we always cry about pollution, but when we go to the southern part of India, the coastal regions, Kerala, the AQI is very less. Is it actually impacting the lung cancer incidence? So things like this, you can always think out. But the most important one is your thesis or dissertation, the bread and butter probably to start at a residency level regarding research. Interestingly, yesterday I had conducted a poll among the PSM residents about how we actually choose the thesis topic. Now, if you see, if you attend any research methodology, or any teacher will tell you, you should get a research topic from literature search. You can also have new ideas. Your imagination and fantasy, you might be the Harry Potter of your domain to actually think about some new thing. Your guide might be guiding, telling, okay, better do this. Your guide might be forcing or something else. Now, if you see, guided 11 students out of around 20 students. So roughly, if I even extrapolate this to a bigger population, you would realize it is the guide who actually pushes you towards a thesis topic. But it cannot be guide forced. It is guide guided. So you as a student should reach out to your guide saying, sir, ma'am, I am interested in tuberculosis, where I want to explore probably a newer regimen, or probably the impact of giving a dietary supplement and looking into how tuberculosis is different for a group getting the dietary intervention versus not getting the dietary intervention. So that is how we actually choose the thesis topic. Over to you, sir.
Then in respiratory medicine, how to choose the right topic? Now, majority will be having this doubt. Sir, I just joined residency. It has been just 1 or 2 years. Now people are asking me to choose a topic. So first thing, you have to do some local research. You select one mentor, your guide and co-guide, and you should ask them what is their interest. So you no need to directly go and ask them. At least you can know from the seniors, and by observing them, you will be knowing that some might be very much interested in ILD, some might be interested in asthma, some might be interested in COPD, and that should align your interest. And it should be feasible in your institute, and you should be able to do 1 to 2 years. Now, some resident will come to me and say that, sir, I want to do a lot of research in lung cancer. I want to do next generation sequencing. I want to do an immunotherapy. Those things are distant dream for residents, and it may not be available in most of the government institutes. So most important thing is feasibility, whether you are able to do that topic in your institute within 1 to 2 years. And don't think residency is only thesis. It is combination of everything. You have to spend time for your duty rounds. You have to spend time for preparation of your university exam. You have to spend time doing other things. Some might get married, some might have kids, and everything along with this, you have to keep your thesis also ready. And always it should focus on what is available in your institute, and moreover, how strict your institute is. Now, I came to know that few institutes, scientific committees are not accepting observational studies. They only want interventional studies. Few ethical committees may be having some strict rules. So you have to go through all these rules and regulations with the help of your seniors and your co-guides. So that will help you to choose a topic that can be done comfortably in your institute. And my suggestion is, because you have accepted to be a clinician, you select any study which has clinical relevance rather than just theoretical findings. Something that intervention or that study tomorrow, it should change or at least modify the course of management of that patient in your institute. Only such studies with clinical relevance, which can modify the course of treatment or management, will have good publication potential. Now over to you, sir.
Okay, it's a very interesting thing, which as teachers, we can tell you now. Even we did not know this when we were students, and definitely we didn't do it. And we burned our fingers, no, we burned our hands to actually learn it. So a very simple tip I would like to give you is, before you start your journey, just do a research methodology course. These courses are available by the Government of India free of cost. On the SWAYAM portal, you can do it on YouTube. Your college might be conducting. Even at DAMS, we are having such courses. But do it, boss. Doing it the first thing. And doing does not mean just listening to the videos. You need to actually be a student who takes a pen and paper and starts jotting down. because these are things which 99.99% of us do not have any exposure at MBBS level, even if you are from a very good medical college at MBBS level. Because this research methodology course will teach you some cheat codes, like whatever you think, do a pilot study. The moment you do a pilot study, you will realize the mistakes you are doing. Second, always keep a MD-PSM buddy with you, because that guy is actually going to make your life easy, rather than at the end you reach out to him or her and he advises you to actually modify your results and give you something what you want. Better than that, start afresh, keep your sheet clean. Next, like making the tables of results, empty table of results at the time of making the plan, because then you know, okay, this is what I am actually going to do. Plus, it is always advisable that the introduction, the review of literature, you should write beforehand, because you would be submitting your thesis after 2 years. But trust me, on the day when you are going to submit, 8 hours prior to that, in the middle of night, you will be writing an introduction and review of literature, and which will be absolutely crap. Whereas you have a lot of time now, just finish it off. Plus, daily 15 minutes you can spend not on your Instagram, but probably going to YouTube and learning something good as a software. These are some cheat codes which you will understand when you do the research methodology course. So guys, just do it. Over to you, sir.
And coming to anatomy or structure of a good thesis in respiratory medicine. First, your title should be very clear, concise, and meaningful. So your title should give the information what exactly you're trying to do or trying to prove in that study. And background, you should be able to define the problem, why you want to do this study in this institute, and what is the research gap when compared to previous studies and your study and the patient's approach, what is missing here, what you are going to fill by doing this research. And your objectives should be precise and clear. What you want to achieve, how you want to achieve. And methodology, as Dr. Siddharth sir has told, you should be perfect in knowing what is your study design, what are the tools required for this study, how are you going to calculate the sample size, and later how are you going to do this data analysis. See, we all in our institutes, we will be having a lot of patients, but how to accommodate that patients in a research, how to design the study, and what are the tools that you have to employ, how to calculate the sample size, and finally how to analyze the data. These steps will only define the outcome of the study. And finally, you should always have a timeline, because your residency is only for 3 years. By the time you adjust to your department, your seniors and your faculty, 1 year is gone. Second year, DRP, that is also gone. And by chance you get married or you are in a relationship, another 6 months is gone. You're left with only 1 year. In that 1 year, you have to prepare for your university exam. You have to complete your thesis. You have to prepare for your NEET SS. You have to take care of your family problems. Everything is not possible. That's why if you start early, it will be very, very comfortable in your residency. Now, one title that I would like to suggest, just an example, how it should be clear. Diagnostic utility of ADA and cartridge-based nucleic acid amplification test in tuberculosis pleural effusion or tuberculous pleural disease. Now, what you're trying to do, you're trying to see the utility of two tests, ADA and CBNet. And where you want to do it, you're thinking to do it in tuberculous pleural disease. Like that, your title should give some basic information what you are trying to do. And always have a timeline like this. 1 month for thesis protocol and ethical committee clearance. Then data collection, patient recruitment, all those lab analysis, everything 2 to 8 months. Then data analysis in 2 to 3 months. Then thesis writing and submission, it will take another 2 to 4 months. So any good thesis, if you want to do it, it will at least take 12 to 14 months. And most of us who are residents, when we are not aware of this, that research is so important. We were doing it in our final year. But for your generation, along with all the fellowships, along with all the specialities that you are doing, your research potential is the one that is finally getting you name and fame on a global platform. Then few trending topics that I would like to tell for those who want to select a thesis topic. These were all gathered from last 3 or 4 years conferences. Now, if you think your interest is in obstructive airway disease, there is pheno, spirometry, and impulse oscillometry also. You can compare those two in asthma. Pulmonary rehabilitation in COPD. So you can also do a comparative study. Patients whom you have done pulmonary rehabilitation and patients who did not undergo pulmonary rehabilitation after 6 months, what was the difference in their exercise capacity, what was the difference in their functional capacity, all those. Then OSA and COPD is also a trending topic. And in ILD, depending upon what is available, if CT chest is available, DLCO is available, you can correlate those findings. And if there is a rheumatology department, you can collaborate with them and check how this CTD, that is connective tissue disorder related ILD, is presenting at your institute. Then TB, always bread and butter for any pulmonologist. ATT outcomes in elderly. Then these days we are having a lot of MDR, XDR tuberculosis and drugs such as bedaquiline, delamanide. You can discuss their safety and you can discuss their adverse events. And the role of CBNAT in confirming tuberculosis cause of empyema. Then somebody is interested in pleural disorders. You can compare thoracoscopic biopsy, pleural biopsy versus ultrasound-guided pleural biopsy. And if your institute is having indwelling pleural catheter for malignant pleural effusion, you can also think of the outcomes. Then you are interested in interventional pulmonology, very simple study, role of medical thoracoscopy in undiagnosed pleural effusion in your institute. And also you can do a comparative study, pleural fluid cytology, cell block, pleural biopsy in pleural effusion. Then as usual, ADA and CBNAT in pleural effusion. Then if you are interested in sleep, OSA, obstructive sleep apnea, and type 2 diabetes mellitus, CPAP in hypertension, then sleep disorders in ILD. If you are interested in infections, post-COVID sequelae, fungal infections in ICU, community-acquired pneumonia. Now, a lot of focus is on antibiotic resistance, antimicrobial resistance. You can do a study where you can note down what is the resistance pattern of organisms of community-acquired pneumonia. These are only few topics. I have round about 100 topics which I have filtered over the last 5 to 6 years. Anybody who really want or who is confused what topic to do, you can just drop me a message. I will help you. Then how to gather information for this thesis topics. Sir, my faculty is asking me to get some standard references. I say these are the standard references that we are following for the last 20 to 30 years. American Thoracic Society has this American Journal of Respiratory and Critical Care Medicine. European Respiratory Society has this European Respiratory Journal. And American College of Chest Physician has this Chest Journal. British Medical Journal, BMJ, has this Thorax. And BMC has Respiratory Research. This you can consider as standard respiratory journals where landmark research is being published. And if you want Indian journals, I always advise go through Lung India, Indian Chest Society, not just for your thesis. Whatever in Lung India they give as review article, you can expect that as a question in recent advances as an essay. And for tuberculosis, we have Indian Journal of Tuberculosis. And also there is another good journal from VPCI, Indian Journal of Chest Diseases and Allied Sciences. There are also many other journals, but per se, if you take an article from these journals and show it to your guide or co-guide, this is considered as most authentic source of information for respiratory medicine. Now, what should be your process from thesis to publication? If you want to publish, choose your target journal early, because each and every journal has a different process, different way of scrutinizing the manuscript. You have to understand the manuscript structure, use all those tools so that the plagiarism is checked, and always collaborate with your PSM colleague. Now, whatever studies that I have published over the last 5 or 6 years, each and every time I collaborated with my close friend who is actually a PSM guy. So without them, analyzing is very difficult. And this will always enhance your academic CV. You have to attend few workshops, conferences. You can apply for research grant, ICMR, and even Indian Chess Society for young researchers. It gives a grant about 75,000, and even NTEP, National Tuberculosis Elimination Program, and also NPTEL, they also give some grant when you are doing research, especially on topics such as tuberculosis, and present at conferences, forums, and use platforms such as ResearchGate, LinkedIn to enhance your presence in the field of research. Now, coming to summary and key takeaways: start early, stay organized, choose practical and relevant topics, learn and apply research tools. Don't think that thesis is only for your residency. By chance, tomorrow, if you become a faculty in medical college, assistant professor to associate professor, you need 2 publications. Associate to professor, again, you need a publication. So research is everywhere. No, I will go into corporate setup. Corporate setup, tomorrow, if somebody wants to call you as a faculty, so he generally sees your research acumen. Your research will be the sole thing that is going to reflect your experience. Publish and build a strong academic footprint. So now over to Dr. Siddharth sir.
Now, to help you guys, we are having a specialized course on research methodology on the eMedicoz app. So you can go to the eMedicoz app, into the resident course, and have a look into this particular course. There will be 20 topics which we will be running, and each topic is roughly around an hour or slightly bit more of that, depending upon the topic. It's a live session where we would be discussing on a two-way manner, when I will be taking your doubts as well as compared to any recorded version of this video. So you're most welcome to look into this course, have a sneak peek, and if you have any queries, please feel free to reach out to me, and do think upon it before you actually negate that research is not important. Because as we started our discussion, it's your paycheck, it's your recognition, it's your dreams to go abroad and roam the world, all are at stakes. Yes, over to you, sir.
And for any respiratory medicine queries, you can directly contact me, and I have also free WhatsApp group. There I will be giving all updates. And who wish to prepare during their residency for their theory exams, NEET SS. So this is resident pulmonology course. Now I'm happy to announce that now we have more than 1,000 residents. This is India's and probably world's largest resident pulmonology course. And I'm always thankful for all your support. Always stay curious, stay research oriented. It will definitely give international fame. So for any queries, you can contact me at this number. I'll also forward sir's number. If you are having any doubt in research regarding the protocol, regarding the submission, regarding the master data analysis, Siddharth sir is very student friendly and he will be always helping you. So before we conclude, sir, your final take home message to the residents.
Guys, the word research, if you break it, it comes as re and search. Yes. So please remember, you are doing a search for yourself, for the community, and for the humanity as a whole. So this is one domain which, when you go at an international forum, is imbibed right from the childhood of a medical professional abroad. But in India, it hits us when we are the PG resident for the first time. But it is worth to explore, and trust me, you will really enjoy to walk on this path. That's all from my side. All the best.
Yes, sir. Thank you for enlightening all our residents. It was great pleasure sharing this stage with you. Thank you, sir. Thank you so much.